Good evening. Hello.
Hello.
Can everybody hear us?
Yes, we can hear you.
Okay. This is Rebecca for the record, Vice Chair. I am calling the meeting to order. It's 6:02, 6:03, 6:03. So we're gonna do roll call.
Okay, so we are at quorum. Ann Corey,
Here.
Rebecca Paris,
Here.
Perla Garcia,
Present.
Scott Benton, Jose Gomez,
Here.
Jessica Mahone.
Here.
Vice President, we're at quorum.
Thank you. Moving on to item 2. Items for presentation, discussion, information, and/or action. This is public comment.
There is no public comment.
So moving on to 2.01.
Okay, good evening, everyone. Thank you, Vice Chair Paris. I did want to take a second to welcome our newest committee member, Jessica Mahone. Thank you for being here and thank you for participating. And I didn't know if you want to say anything about yourself and introduce yourself.
Sure. Thank you. For the record, Jessica Mahon. Excited to be here on the committee. I'm pretty much a native Nevadan. I grew up in northeastern rural Nevada and have been in the Reno area since 2012. I'm a social worker, and in my current role, I am the program director for workforce development and weatherization at Community Services Agency. But prior to that, worked for a long time with Girl Scouts of the Sierra Nevada to make sure we were extending opportunities to families in need across our service area. I care deeply about making sure that families and kids in our communities have access to the resources and tools they need to be successful. And I look forward to being able to participate on this council with you all and hopefully help make sure that the FRCs have everything they need to be successful as well. Thank you.
Thank you so much. Welcome. Thank you for telling me the right way to pronounce your name.
No
too.
problem. Thank you.
Welcome. Thank you for being here. It's good to have you. So moving on to 2.02, approval of the minutes of June 2024 meeting on the Council of Family Resource Center. Any discussion?
I have one correction to make, and that is under item 3.02. The next meeting is listed as January 15th, when in fact it's September 18th. Oh, no, it is January 15th. I am displaced, sorry. I withdraw that correction. I would move for approval of the minutes. This is Ann Corey.
Perla Garcia, second.
Do we have
Public
public comment first? Right?
We have none.
Okay. So then I can ask for a motion.
Mm-hmm. They did their motion, so now you can ask for them to vote.
Okay.
You're going to say all in favor of approval of the minutes?
Sorry, bear with me. All in favor of approval of the minutes? Say
Aye.
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 I forgot. Anybody opposed?
See,
No?
motion
So the motion passed. Okay. Moving forward to item 2.03, presentation and discussion of the Washoe County School District Family Resource Center's funding status, including the status of grant applications and possible actions to provide recommendations to staff on scheduling before future fundraising and publicity events.
Okay, hello everyone. Rochelle Murillo for the record again. This is partially mine and partially Chair Benton's, and he's not here today, so I will fill you in. This is a sort of a standing agenda item for this committee so that we can update you on our current funding status we are entirely grant funded, and so the grants do come and go, and our our funding status changes. He also wanted to keep this on the agenda item in case there was anything in terms of fundraising or anything else that you all were interested in giving us some direction around moving forward. This committee has talked about that before in the past. We haven't done anything action item. You don't have to vote on anything tonight. But you can if you so choose to, because it is an action item. Just to give you a little bit of an update, so we're all currently, for this current school year, our fiscal year goes July 1 to June 30th. We're currently funded for 5 family resource centers. We did lose 2 staff during the summer because of cuts within grants. So I would not say that we are fully staffed at all of our family resource centers, but we do have staff at all of our family resource centers. The challenge of being understaffed is that you can't always meet the needs of the community as they're coming in as quickly as they need to be met, especially when families are coming in crisis. With that said, June 30th of 2025, we are slated currently with the current funding that we have to lose an additional 3 staff. So we have 2 grants that are going to be sunsetting June 30th of 2025. If we're unable to secure any additional funding, we are most likely looking at the closure of at least 1 family resource center. Which one that would be is not something we have discussed yet. We're hopeful that we'll be able to find funding. And so with that, and in looking for additional support, right now, again, rental assistance or weekly motel assistance is a large need for our communities. We have for the past 3 years utilized American Rescue Plan funds 1 and 2 that we had through our McKinney-Vento program to pay for weekly motel stays for families who are at immediate need of being placed somewhere so that they're not unhoused and on the streets or living in their cars. Those grants will finish September 30th, which is in a couple of weeks. So we won't have access to those funds. So that's funding that's going away for weekly motel assistance for us. And those were primarily for families that were designated children in transition or homeless under the McKinney-Vento definition of homelessness. We are in the process of applying for the Family Violence Prevention Act grant, and that is working with families that are impacted by domestic violence. So we're in the process of that. Brenda is feverishly writing that grant right now. If you have any research or any information for her that you feel like would be useful, please pass it on because she's in the middle of writing that. She'll primarily be working on direct services. There's not enough funding for us to put salaries in there at this point, and it's the time period is not long enough to be realistic to put staff in that grant. We're also working with a community task force group. It's being headed by a nonprofit called Strengthening Communities. Mike Kazmierski, who was previously the chair over EDON, is leading this effort. They have identified 10 sort of systemic issues that they feel like they can make a difference in that will impact chronic absenteeism within our school district. As they see that it's a concern for us. We stayed at 23% of our school district was chronically absent last year. That's still several thousand students that were chronically absent last year. So this is a priority for them. But one of those many subcategories that they are working on is expanding family resource centers. So they recognize that if families are living in crisis, if they have inconsistent housing, if they don't have access to food, if they don't have power to keep lights on and the heater or the air conditioner running, those sorts of things, those negatively impact our students' ability to engage and be academically successful and to attend school. So in recognition of that and the work that Family Resource Centers do, they have a goal of expanding Family Resource Centers by June of 2025 from 5 to 10. I've also asked them to consider sustaining the current staff that we have, as we're due to lose 3 staff in June. We are doing sort of a kickoff event with this group, and they're going to be detailing all the different priorities or initiatives that they're going to work on, including family resource centers. I'm presenting that initiative, but there will be initiatives around funding re-engagement staff who work on chronic absenteeism at a middle school level. They're looking at expanding before and after school programs. They're looking at innovative ways to tackle transportation so that if families are struggling within a walk zone to get to school, they can address that, but also allow students to participate in after-school programming like sports or intramural activities or tutoring. Currently, if they want to do that and they're taking the bus, then a family member has to drive them home because the bus has already left. So they're looking at some of those things. They're looking at expanding childcare so that families can drop their children off at high quality childcare and be able to work and be able to get their children to a before after school program if they're school age. So those are some of the things that that they're going to be talking about. But Family Resource Centers, for the purposes of this committee, is going to be presented too. And we're asking for people to share information about Family Resource Centers, come visit a Family Resource Center. If they have staff that are doing some of the same work, potentially partnering with us or co-locating staff, and if they are so inclined, provide us funding for staff to help solidify our funding and our sustaining. So that's what's going on with that community action. If you're interested, let me know. I'll send you the invite. Remember, if we have to be mindful of those kinds of things, because if we had quorum there, then we would have to work through some of that. But if there's a couple of you, if you are mindful about where you sit and you're not sitting together and you're sitting apart and we're not talking about this committee during that meeting, then it's something that we could look into. And correct me if I'm wrong, Sarah, on that, but I think we could work it out, especially if we only have a couple of you that are interested in attending.
This is Ann. I'm planning to go.
Okay. Happy to have you, Ann.
This is Rebecca, for the record. Is this like a partnership, or are they taking over like that type of stuff?
They're a task force, and this is entirely a community-driven task force that's working on some of these things. So there are school district people there. I participate in it. The chief over my department participates in it. There are other chiefs that are a part of that work. And are contributing to it and helping them to understand the scope of the issues. But it is entirely driven by this community task force.
So they would help with providing funding or finding ways for funding? Or is
That's
that
the
kind
hope.
of-
That's the hope.
Sorry, Rebecca. When is this again?
Next Thursday, September 26th, I believe it's at 4 o'clock at Swope Middle School.
I have a question.
Yeah.
McKinney-Vento funding.
Yes.
I was understanding that it would be renewed. Is that not the case?
It
at
is.
all?
So we have different pots for children in transition or students that are identified as homeless under McKinney-Vento. That's a different definition and criteria than HUD, right? So for students that are identified, we have McKinney-Vento. We did get that grant. That's under children in transition, and it serves students that are designated as homeless only. We also, through COVID, got pretty large grants to help support and fortify some of the supports during that critical time period for families that were homeless. And some of that were weekly motels that Family Resource Centers utilized for the families that were coming into Family Resource Centers that were identified under McKinney-Vento. So those have sunsetted because those funds are done now. They will sunset September 30th. So now Children in Transition has McKinney-Vento, which is a fairly small grant, and some set aside for Title I for homelessness. And they primarily pay for salaries for homeless liaisons to follow through with supporting students that are homeless.
Thank you.
Rochelle, I have a,
Yes.
this is just down for the record. What other grants are you guys looking at? Like, have you guys looked into probably looking at like the GSR? I know they have grants as well, like Walmart. I know I've been in conversation with Smart and Finals kind of thing. They have certain foundations that can work with specifically in education. I had those meetings with them, and they're willing to give out some of those funding. I know they're probably not a lot, but I think it's something to look into as well.
Yeah, so if you have any information on grants that you think would be beneficial for us to review, please do send them our way. We do appreciate that. I will also say that much of our grant writing is led by our amazing grant department, who oversees a significant number of grants, some of them very, very large, that support the school district as a whole. So with these smaller grants, sometimes we have the time to write them, but we don't always have the capacity or the time to write them, and the grants department can't always support them, depending on how competitive they are, those kinds of things. Because staff are working with families, they don't have a ton of time to write grants. So we have to think about which grants we're applying for to make sure that they are in alignment with the mission of our family resource centers, and we have the time to write them and follow through. And we're doing that in collaboration with our grants department. So some of those might be ideal, Jose. So anyone that you think of or see, if you send them our way, we'll review them and see if we're able to apply for them. And those kinds of grants, typically they're smaller. They don't like to pay for salaries. They'll pay for like gift cards for us, or they'll pay for food pantry items, refrigerators for us to store consumable items so that we can give those out, those kinds of things. But our primary need is long-term sustainable grants that are going to pay for salaries for staff in our department. If that makes sense.
Perfect. And for yes, totally understand. And for those two lost family advocates what does their typically salary look like?
The family,
if there was a grant.
yeah, the family advocate position. So all positions in the school district recently changed because all positions got pretty significant increases in salary. So I'm going to have to look that up for you unless you guys know it off the top of your head. I don't know it anymore. Oh, here comes Brenda. She's going to tell you.
You can just look at which one. Maybe Adelia. That's including benefits.
Okay, so we have listed one family advocate with benefits. So benefits can cost in the school district upwards of $20,000 for health insurance and those kinds of things. So for that salary with benefits, it's $58,000.
Okay, perfect. Thank you.
Yeah. All right, that's all I've got, unless there's any other questions.
Any other comments? Does anybody have a motion or any public discussion, comment?
Well, the portion of this agenda item is if there's any actions, any activities, and again, you all don't have to move forward with any of that. If there is none, then there is none, and we'll move on. But if there is, this is an opportunity for you to discuss it, bring it up, and then you can make a motion if you so choose to and vote on it. And it's primarily around fundraising and publicity events.
Would it be helpful for us to pass a motion supporting the Family Violence Prevention Grant. Would that make any difference?
You could do something like that, and we could write it into the grant.
I would be delighted to. I move that we offer our formal support for the Family Violence Prevention Grant.
Perla Garcia, I second.
Is there any public comment?
There is none. Is there any other discussion? Okay, you can
All
call for a
those-
vote.
What was that?
You can call for a vote.
Okay, all those in favor, say aye.
Aye.
All those opposed?
I
I keep forgetting that. Sorry. All those opposed? All right, motion passes.
I did have one question, if I'm able to ask about the fundraising piece. I think in the past, maybe we might have asked, like, what efforts have been tried in the past for fundraising. Did we get like a list of those, or just to see which ones were successful?
We don't typically do fundraising. We write grants. So we haven't done, that I can think of off the top of my head, fundraising per se. So that's not something that we've had the capacity to do with this current staffing. Unless, I mean, Family Resource Centers have been around for nearly 30 years. So I'm sure there's been some fundraising efforts in the past that I am either not remembering or I just don't know about. But I cannot think of any that we've really fundraised before. Fundraising is a tremendous amount of work. And we just don't have the capacity right now to put on like big fundraisers at this juncture of where we're at with staff.
Thank you.
That doesn't mean we couldn't do something small if we have targeted sorts of things where we're deciding we want to do fundraising for gift cards or gas cards to help people to get to medical appointments or those kinds of things. Those are things that we potentially could do in the future.
This is Jessica for the record. I think one of the kind of easy wins sometimes are those passive fundraising opportunities around signing up for, like Amazon Smile and making sure that the FRCs are maybe listed as one of the like target local beneficiaries for people's reward points.
Right.
And so I could certainly send over a list of some of those local opportunities. Smith's has a similar program where folks can shop and choose to donate their points or their change to a certain agency. So some of those are fairly hands-off once the setup's done and don't require a lot of that.
Yeah, that
intensive.
would be appreciated.
Absolutely.
We do have a gifts and donations account, so it would typically go into that gifts and donations account. And one other thing, just as a reminder for the council, that we do have the Family Resource Center Recognition Day in May. So the last time this council discussed it was around sort of the recognition of that day in May and potentially a fundraiser. If this council wanted to move forward with it, you could discuss it again. You could potentially vote in future meetings if you wanted to, and we would have the time to put together a fundraiser if we were to do it in May.
This is just on the record. I think it would be a great idea to maybe in January, our next meeting, to have a discussion about the May event as a fundraiser opportunity. Just the fact that I know like those like class membership gym courses, like I go to Orange Theory and I know that there's every month we have a fundraiser opportunity. We pick the local organization picks like a specific organization, and then I've seen raise up to $5,000 to $10,000 within just in our community. So I think it's just finding those different local organizations like Jessica was mentioning and really ask them if we can do something around those fundraising opportunities as well too.
Any other comments? Okay, moving on to 2.04, presentation and discussion of data and outreach events. including future community outreach events and volunteer opportunities. This is for presentation and discussion only.
Jose, I'm gonna pull up the attachment so you can view it here, so just bear with me.
If it's stuff that Lisa sent to us, like the event collaboration, I have them all all the stuff ready to go.
Is that it, Lisa? Yes. Okay, yes, that's it.
Hello, Council. I'm going to start by sharing with the data of this new school year. If you can see here on the first sheet, is the first data of our call rail database that we use to make phone calls and text messages to our clients for the time period of July 1st through September 16. Between all of our 5 centers, we've done a total of 2,275 calls using CallRail, and this does not account the landlines that are not connected with the CallRail system, because CallRail is fairly new and it was implemented during the 2020 COVID time. So with that being said, along those lines, the text conversations between the same period between July 1st and September 16 between all 5 centers, we've received and also sent out a total of 1,548 text messages conversations. Any questions on that section that you may have? No?
Yeah, Jesse, maybe you have this is Jose by the record. I don't know if you mentioned this the last couple times I've been on. But have you guys is there a way for you guys to keep track on what type of conversations you're having with the members? For example, if they're coming for like the food bank or they're coming for rental assistance, is there a way for you guys to know what conversations to have to see what is the majority of your guys' efforts with the families that you serve?
We do record the services. Thank you for that question. And I forgot to announce myself. This is just Segura for the record. We do record services provided and conversations provided a separate database called eLogic that we do with each client, the visits or calls. And so we do provide those services records just because we have to keep track of all the services we're giving out and then all the referrals we're giving out. So it's not just conversations that we keep track on. So, but all these text messages do stay in record within the CallRail since we started using it in 2020. But none of the conversations get recorded, if that's what we're trying to say. We can't because of the policies we must follow under our Washoe County School District. Thank you for the questions, though. Any more questions? Did that answer your question that you had, Jose? I'm sorry.
No, yeah, that definitely answered the question. I just wanted to see what it like. I know you guys do a lot, and I just want to see if there's way to capture all the efforts that you guys are doing, because this one just gives us a little chart, but doesn't really pinpoint what are you guys' efforts in the FRC. And we just had the previous conversation of like doing fundraising and exposing you guys to more in the community. So I was trying to figure out how we can connect those both to when we're like me in the field having those conversations,
right?
And it's just showing these people you're just calling people, but no, you're doing X, Y, and Z.
So what we can do for next meeting, I don't know if everyone agrees or not, what we do internally is we do several reportings monthly and quarterly to the state, which pulls out all this data that's entered in eLogic that we just talked about in regards to services, notes, and all the efforts that we do at each of our centers. It's all combined into one. And so maybe we can share that for the what we did the first quarter. So it includes information from July, August, and September. Will that be something that the council may be interested in seeing and hearing?
Definitely.
Okay, we will include that on our data share. Thank you. The next information is about our Google pages that we each have. And basically how do people find us? How do they know about us? How do they know how to reach us? And what are they looking for when they're typing in on Google in regards to these services? So the data between July and September, it's separated by each of our centers. So for Central Reno, that's located behind Worcester High School, it looks like a total of 2,195 people viewed our business profile for Central Reno. You can see there the breakdown in regards to looking for the Family Resource Center, what they typed in on the search box: Family Resource Center Reno, Social Services Reno, Parenting Classes Reno, Resource Centers. And then it's broken down by percentages in regards to the search. It may look, I have the black and white copy, so you guys may have the color copy that was sent on email, and that made better sense on the percentage breakdown. Same case scenario with next centers on North Valleys. 2,314 people view that specific profile on Google. Basically almost a similar assistance search, except for the emergency rental assistance and welfare. 34 people were looking for rental within that July 1st and September 16 timeframe. And it goes on to the next sites for our FRCs. For Sparks, 3,965 people, so that's a huge difference, as you can see, compared to the first two. The searches and topics are somewhat similar, but you can see the increase on rental assistance search went up to 62. And that's always big, but there's also rental assistance Sparks Nevada that went to 72 searches. So that's a huge increase, and we can see the difference in logistics and demographics and depending on the area. The last one in Sun Valley, 1,222 people looked up that business profile. And again, just general assistance, community resources, etc. Moving on to the last section, before I do, any questions on that Google business data?
It's Jessica, for the record. I was just curious if those numbers mirror the capacity at those sites. Does Sparks tend to be the busiest FRC, or is that just a kind of an outlier? Because that was a huge jump from some of the other searches. I thought that was kind of interesting.
I'm going to let Lisa speak to that because she oversees the Sparks FRC location.
Thank you, Jesse. Lisa Guzman for the record, and thank you for the question. So I don't know that it necessarily does mean that Sparks is the busiest, because I think we all have a lot of traffic. We all have a lot of rental assistance. And Jose, when you were asking your question, it sounded like you were kind of getting at what are some of the biggest needs maybe that we're seeing. Hands down, rental assistance. It's just through the roof at all of our centers, probably followed closely by utility assistance and then maybe food. I don't really know why Sparks is so much higher for rental assistance. I mean, I can tell you that the vast majority of the calls are for rental assistance. But I can't speak off the cuff on how our numbers compare with the other centers, because we kind of combine our numbers for reporting.
Sure, yeah, I was just
purposes.
kind of curious.
But yeah, the rental assistance is huge. It could. So. Oh, go ahead, Jose.
Oh, sorry. Go ahead. Just based on this is Jose for the record. Going on what Jessica was saying about the rental assistance, I know you guys are limited on rental assistance. I think there's specific criteria that you guys have to go through for them to be eligible for rental assistance. Do you guys have other community partners that you refer them out to that might help out for rental assistance?
Definitely, yes. This is Lisa for the record. So we will always try to connect them with our community partners in hopes of them getting assistance there first. And we're there to partner with the families and walk them through the process, support them in whatever way we can. Unfortunately, these days, we work with a lot of families that have exhausted all types of assistance. They've already gotten assistance from multiple agencies. they're not eligible anymore, and we're just seeing some really difficult situations. But yes, that's definitely our first line of defense, to connect them with any and all appropriate partner agencies that are providing rental assistance. Thanks, Jose. Oh, and Brenda reminded me, as far as Sparks, this is kind of strange on Google, but sometimes if people are looking for the main office of the school district, Google takes them to the Sparks Family Resource Center. So I don't know how much of an impact that might have, and I don't think people are necessarily looking for rental assistance through the district, but that could be tampering with our Google numbers a little bit.
I also, this is just in it for the record, I wanted to add, Sparks has been the one location that hasn't gone through that many changes, along with Central Reno behind Boosters. So there's, through the years, the almost 30 years that FRC has been active, I know there's been changes based on funding availability, so that has made movements, and so the numbers have always changed until 2020 came, and now we have those call rail numbers that even though we move around, they will follow us. So prior to that, we had landlines, and they've always changed. So there's always old numbers that are no longer active with our sites, and Sparks has been, and Central have been, along with Sun Valley, the previous location at Sun Valley have always remained the same numbers. So maybe that could be also a factor. Thank you for all the questions, and actually asking very positive and nice questions that you guys can get to know more of our history and why we see what we see. Sometimes we tend to forget because we see it every single day, all day long. So we're like, oh, that's something just that comes up with the work we do. So thank you. The next section is our family success stories, and this time we picked one from Central Reno. So what they share was that their office had many walk-in people come in and go in calls, but this specific family was a single mom with 2 children needing assistance due to being displaced from a friend's apartment. The office, they provided many resources, including a referral to the Domestic Violence Resource Center, previously known as the CAW Center, where she was able to get shelter the same day. And the following month, she came back to the Central Reno office and was referred to the Housing and Stabilization Program through the Human Services Agency. And the client had a Social Security income, and with the help of also Human Services Agency, were able to secure an apartment for her, and that she was able to move in with her children by the end of the month. Both agencies collaborated, ourselves and the Human Services Agency paid for 10 days in the motel while she waited for the apartment to be ready. She and her children are now have stable housing following a very difficult situation. Any questions?
Perla Garcia for the record. Just wanted to make a comment. This tends to be like my favorite part of the meetings, just because I feel like you're right. Sometimes during our day-to-day, we really forget all of the things that we do. So during these moments, you're able to just kind of pause and like reflect on how like even just having a moment of compassion with the family can really like bring them from, you know, feeling really low to then feeling empowered to make some of those positive changes for their family. So thank you, because this is amazing, and I'm sure it gives her hope that she can do this on her own, and she knows who to reach out to when she needs help.
There's definitely really good positive outcomes. We really, like you said, reminds us what we do, and why we're not able to do this alone. If we don't rely on other agencies that partner with us on a day-to-day basis, we wouldn't be able to do the work we do. And with an amazing boss, I mean, we can't do anything.
Lisa Guzman for the record. I'm going to share information about our events and collaborations since we last met in June. As usual, we have been out and about and very busy in the community. We continue to partner with the food bank to have SNAP outreach at all of our sites, which means that clients can come in and apply for SNAP and Medicaid at the Family Resource Center without having to go to welfare, which is a really nice thing. We also continue to serve as intake sites for the SAFE Utility Assistance Program, as well as the Energy Assistance Program through welfare. We attend SARB and ESARB meetings for students with chronic absenteeism. We had just today, actually, food distribution at Sparks High School in partnership with Catholic Charities. We do outreach at the mobile harvest sites in conjunction with the food bank at Sun Valley and our North Valley sites. North Valley's Sun Valley and Feimster continue to have biweekly food pantries, and North Valley's has a weekly Golden Groceries food pantry for seniors. Sparks partners with Northern Nevada Literacy Council to host a small group adult ESL class on site. We attended the Reno Police Department Victim Services Unit community outreach event over the summer. We had a family health festival at HUG last month. We were very busy with back to school events, very busy time for the FRC. We attend as many of these as we can. This is when cloning would really come in handy. This is a list of some of the schools that we have attended. I have a feeling that this does not include everything, but you can see that we attended many back to school events this season. There were also some back-to-school vaccine clinics that we attended. We had a Silver Summit Community Partner webinar. We attended the Nevada Immigrant Coalition meetings. This was very nice. The 4 Medicaid MCO programs hosted lunch and learns for us, where we were able to meet with them directly and learn about all of their amazing services. We attended the Continuum of Care meeting with Washoe County Homeless Services. North Valleys has co-hosted many events with the MCOs for back to school and a laundry day with Molina, and partnered with Anthem for the Biggest Little Baby Fair. And we attended a TMCC resource fair. We presented at the Children in Transition Advocate Training, and we are very pleased that we have a new fantastic group of UNR social work and human development family studies interns, which are a huge help with our limited staffing. So that's what we've been up to. Some things to note that are upcoming. There is a newcomer family event at Sparks High next week. There's also a early childhood social emotional event for families at Sparks High next week. We have on here as a standing item, the National Family Support Network hosts a webinar Wednesdays that you can always tap into for their events. However, this was interesting that next week they're actually going to have a national forum that is focused on leveraging funding for the Family Resource Centers. So registration for that is free. If you are available, please go online to register for that. We have another Family Health Festival coming up at O'Brien on October 9th, and Jesse is hosting another community baby shower in partnership with Molina on October 17th. Please join us for any of these that you might be able to. And can I answer any questions? And I know if Scott was here, he would ask what my favorite event was. And they were all wonderful, but I have to say, I attended a newcomer back to school event at Sparks Middle School that was absolutely wonderful. There were many different agencies there, a great turnout, and families were just so appreciative to connect with different agencies and get information on programs and services that could help them and their students. Thank you.
Hi, this is Jasenia for the record. I just wanted to, we almost forgot. To add that thanks to Molina Healthcare Medicaid, we were able to have some of our staff be a part of the community health worker training certification class that we did online. And this time was the Spanish version, so including myself and a few family advocates, and also Jean, the specialist, my colleague at Central. We were all just certified and were able to get our certification for community health workers once. So thank you, Molina, for that partnership, and that was really great. So now that Jose's here, I know you're here as representing yourself, but you're also a part of Molina, so thank you for that. Just wanted to make sure we didn't forget for that shout out. And thank you, Rochelle, for reminding me.
That is fabulous. What a great tool that will be in helping you help families.
Well, and on the topic of funding, right? So in the future, if we were able to bill Medicaid for any of our services, this will help us to do those things. Lisa and I are licensed social workers, and then we'll have community health workers in our family research. So again, thank you, Melina, because that could potentially be some sustainable funding for us in the future.
I have a question.
This is Jose for the work. Oh, sorry. Go ahead. Oh, just want to know. I know a community health worker, but just to have, because now that we have this recorded, what is a community health worker, and what is so important? Why is it important to have community health workers in the school district?
I personally feel like there needs to be more support shown, not just for the students that are in class every single day with their teachers. There needs to be a connection beyond that with our community. Especially, at least I can speak for the North Valleys. We have very limited access there for resources and services since we're considered still a desert area. And I feel like the more information that's available there for our community, the more education will be given, not just for the community itself, but the school environment also, so we can go hand in hand together and kind of have a more successful all-around family and all-around community to be able to receive those services when they're in need. Because I know that there's a lot of stuff when someone is going into crisis. Mental health is a very important thing, and as we're seeing with social media, it's playing a big role when in regards to negative information being thrown out there, and that's affecting our youth, that's affecting our parents that come from a different generation and not know what to do, not being tech savvy, and the children, as it feels like when they're babies, they know how to unlock a phone. I know I didn't know that back in the day. So they're being more exposed to technology. With that being said, not always everything that's available it's positive or healthy for them to hear at such an early age. They don't know how to manage that, and the parents don't know how to manage that, and that's affecting overall. And now when you bring in the fact of financial instability, housing instability, and then dealing with mental health on top of that, it affects the family, the community altogether. So having that support with that community health worker, being able to connect them to those needed services, those needed empathy, that needed just having someone to talk to and knowing where to go and help you work around the whole system is very helpful. Because I know when I was younger, I didn't know half of the stuff I know now, and I wish I did know that, being a young mom myself. And just having that empathy and understanding and listening, and not just for families, I feel for anyone, any age at any time, just helping them navigate what's going on in the world today. It's very important, I feel like, to be together and help each other. I know it may sound kind of corny, but it's important to know that someone can help you.
Thank you, Jesse and Lisa, for sharing. Appreciate it. Anything else? Moving on.
Just a comment. Perla Garcia for the record. I just wanted to say I did have the honor of attending your back to school event. And I think it's just amazing to see so many community partners that have that same passion and that are also wanting to go above and beyond to help families, but just to see the diversity, because you're right, especially like mental health stigma. Just for example, in the Latino community, like it really makes a difference when you see someone who looks like you and speaks like you, and who knows like some of the roots to like really help you navigate what's available and help break some of those generational stigmas. So it was really awesome to be part of that.
Thank you.
Okay, we'll move on to action item, or item 2.05, presentation and discussion of the strategic plan.
Lisa Guzman for the record. So I believe everyone has a copy of our strategic plan. So our last several meetings, we've been reviewing the Strengths and Sustainability Project that was led by Sheila Leslie back in 2020. And that was a look at all of Nevada's family resource centers to determine their strengths and impact on the state, as well as areas of need. And out of that grew our strategic plan. This plan was made for 2020 to 2025, so it is getting close to time to renew our strategic plan. But just to kind of wrap up the whole discussion of the Strengths and Sustainability Project, we'll go ahead and just kind of hit the high points of our strategic plan for you. So I'm going to take goal 1 and 4, and Brenda is going to take goals 2 and 3. So goal 1 refers to sustaining and diversifying funding, and Rochelle talked earlier about our funding and some new funding opportunities that we have coming up. So fortunately, for the last several years, we have been able to maintain our 5 sites, and there are some concerns about some of the funding sources that are getting ready to sunset. But we are pleased that within our main funding sources of the State Family Resource Center grant, Title IV-B, Children's Trust Fund, and SNAP, those grants have all either remained the same or have increased over the last few years. We've also been very pleased to grow our relationship with the Medicaid MCOs and to receive some funding from them for various needs. We have been participating in the Family Stability and Community Schools project to try to bring funding for this project to the district. And unfortunately, our grant request was not approved. However, it's an ongoing work group, and we're hoping that there may be additional opportunities to apply for funding in the future. And as Rochelle mentioned earlier, we were very fortunate to have a lot of money from COVID to be able to help families with emergency needs, particularly around motels. It's a really big hit to see that now going away, and we are concerned about that. So definitely looking for other opportunities to fund staff, to fund motel, and other needs. So fortunately, we do have some irons in the fire with the Family Violence Grant and the task force that's trying to bring funding to the Family Resource Center.
Hi, everybody. Brenda Costello for the record. So I have goal 2, strengthen and support FRC staff and their ability to provide efficient and knowledgeable service delivery through leadership development, training opportunities, and peer support. So the strategy was to strengthen leadership skills, and the timeline was like monthly meetings. Rochelle keeps us on track, so we meet actually every other Wednesday, usually a Wednesday for an admin. So it's the entire leadership team for intervention. But other than that, Jesse, Lisa, Jean, and I talk daily, pretty much. Text, talk, email. And then you emailed her, but then I forgot it was an email, but no, it was a text. And so you're looking, and so it always works like that. So we do conduct all staff meetings. We try to do those on a regular basis, but then, Christmas or Taco Tuesday will get in the way, and who knows what we're doing. But we do have conduct an all-staff meeting, and that corresponds with 2.3 cross-training within intervention. We're having a soup potluck in October, so which will be a lot of fun, and we get together, we'll have new staff, and so we actually have, Rochelle has a brand new admin assistant, and so she turns in our payroll, so we want her to know what we look like, so, you know, so that doesn't get forgotten. So we're pretty good at sharing that. We also do usually an end of year training or fun event, and also a retreat, so we always try to combine the fun in with some learning as well. So I think we're pretty good on that, and then we can go to goal 3. Increase communication and visibility of the FRCs internally within the school district and externally. This is ongoing. It's never going to end because there's always turnover, obviously in the community, but even within our school district. So sometimes it can be frustrating for those of us who have been here 18, 19, 20 years to have a brand new admin say, who are you? So we educate and advocate and educate and advocate until our lips are blue. But we will keep doing that because, like, we want the admin in each of our schools to know who we are. We also want the higher ups to know who we are, and in a good way, not a bad way. We try to make our boss proud of us. So for instance, increase the knowledge of the FRC among personnel. Those back to school nights, I counted them. There's 21 of them in there, and there's 2 that I didn't put on there. That was a lot. That's a lot for a staff of, how many are there? 10 of us. So that was kind of crazy. 3.2 is increase efforts to raise the FRC profile in the external community. We have to hand it to Jesse for like raising awareness with a lot of our community partners, and especially with the MCOs. So it is, there's a brand of jeans called Not Your Mother's Jeans. These are not your mother's MCOs. Medicaid has changed so much, and we're so grateful for that. And so that really goes to Jesse and raising awareness with that. And then just ongoing, our board here, you guys talk to your people, then there's a question, and then we get an email. So we appreciate all.
One other thing I want to add real quick, Brenda, we do have, if you have Facebook, we have a Family Resource Center page, and we have a couple of videos on YouTube as well. And so they're really great, and particularly Jesse uploading different pictures so you can see what we're doing. So if you haven't already, then and you are on Facebook, please go like it and share it, and get the information out to your friends and family.
Lisa Guzman for the record. I'll be continuing with goal 4, which is to create a framework for serving families effectively, such as standardized outcomes data to demonstrate the impact of the FRC's annual progress reports in alignment with the school district's strategic plan. So when we undertook this strategic plan back in 2020, we had recently started using the eLogic database. We were actually ahead of the curve on this because we were, I think, the second FRC in the state to start using it, and it is now a requirement of the state that all family resource centers use this database. So we did struggle a little bit at first, but now it's just fantastic that all of our sites are connected. We can see all of the services, all of the referrals, all of the notes for everybody. So we've really come a long way with that, and that's really coming in handy for day-to-day use, but also our grant reporting. So we're really thankful for that. We have also implemented, as you have heard about, the CallRail calling platform, which was great. So thankful that we got on board with that during COVID, because that opened up the texting world to us, because prior to that, it was all phone and people having to come in for an appointment. So if one good thing came out of COVID, it was at least the ability that we could serve people by phone and by text, which is very helpful, especially for our working clients, that it's just really hard. So we've been thankful for that. As far as the district strategic plan, I think that we can be found in every part of the strategic plan, because we all know that if kids are hungry or have a toothache or sick or the lights are off or they're worried about getting evicted and their parents are stressed, the chances are that they're not going to come to school ready to learn and be successful. So by meeting those basic needs, I feel like we really can give our students a boost to be able to be successful when they come to school. So particularly goal 1 of our district strategic plan is a strong start for every child. We're there for that, helping meet those basic needs. Goal 3, safety and belonging, we're there for that. And then we have a pillar B, strong partnerships between family, community, and schools. So we definitely touch on all of these things. Also, working with our colleagues in the intervention department, we really can provide comprehensive services to families that are struggling and get a lot of supports in place to help our kids be successful in school. And then as far as an annual report, Rochelle does do an annual report for the board that includes updates on the Family Resource Center as well as our other programs within the intervention department. Can I answer any questions?
Jessica Mahon for the record. So this strategic plan you mentioned goes until 2020. Is that June 30th of 2025? So is that already something in the works for plans for a facilitated session on a new strategic plan? Is that something that's done internally? What does that look like?
That is something that's done internally. Thank you for the question. I would say we've thought about it. We've talked about it a little bit, but there's nothing solidified.
Sure.
So this is something on the horizon that we do need to start thinking about. And any ideas, suggestions would be greatly appreciated.
Thank you.
All right, thank you, Brenda and Lisa. Moving on to 2.06, upcoming Family Resource Center meeting dates. January 15th, 2025, March 12th, 2025, June 18th, 2025. That sound right? Everybody's good? Okay. Hi. Turned itself off. Okay. And just a reminder of how important it is to come to these meetings so that we can have these discussions is important. Do we have any public comment for closing?
Moving on to 3.0,
Moving
when
on to
we have no public comment.
I actually I have a question on the dates.
Yes.
Oh, never mind. Actually, the dates. Yes, is at the same time with the dates. For the 15th, for January, March, and the 6th, same time, same place, or
We do have it currently scheduled same time, same place at those dates, at this board meeting currently.
okay, perfect. Thank you.
More comments? Okay, moving on to 3.02, next meeting, January 15th, 2025. Wow, 2025. Nobody has anything? Okay. 3.03, meeting is adjourned at 7:04.
Yep.
Okay, have a good night.
All right. Thank you, everyone. We appreciate you being here.
Bye, everyone.